This is how you perform a venipuncture. So first you would verify the healthcare provider's orders. You would gather all the necessary equipment and supplies that you would need. Ensure that the patient has privacy by closing the curtain. Perform hand hygiene and apply your clean gloves. You would then introduce yourself to the patient and their family. Identify the patient by 2 patient identifiers. That would be their first name, last name, date of birth. If they're nonverbal, it would be their first name, last name, and their medical ID number. You would explain the procedure to them and ensure that they understand what's going on and agree to treatment. You would then prepare the IV solution and insert the insertion site. You would reapply the tourniquet 10 to 15 centimeters above the intended insertion site and then check for the presence of a distal pulse. You would swab the insertion site with in like a circular motion with a little alcohol wipe prior to performing the venipuncture. You would anchor the vein below the site by placing your thumb over the vein and gently stretching the skin against the direction of the insertion, about 4 to 5 centimeters distal to the site. And then you would ask the patient to relax their hand. Instruct the patient that they might feel a quick poke, quick stick, and then you would insert the device. You would then observe for blood return through the flashback chamber of the catheter. You would lower the catheter until the skin it's almost flush with the skin. Advance the catheter about 0.6 centimeters into the vein and loosen the needle over the catheter. Continue to hold the skin while stabilizing the needle, and then you pull it out. Do not insert the stylet once it has been loosened. And then while you're stabilizing the catheter, release the tourniquet and apply firm but gentle pressure to the vein about 1 inch above the insertion site to keep the catheter stable. You would quickly connect the Luer lock end of the primed extension set to the end of the catheter, but be careful not to touch the point of entry of the connection because that can provide bacteria to transfer into the blood. Flush the extension set and IV cannula with 0.9 sodium chloride solution. Remove the syringe and watch for any swelling, redness, and then ask the patient if they're experiencing any pain at the site of the IV. You would follow up by securing the catheter and applying a dressing. You would then help the patient into a comfortable position, make sure everything is in reach, especially the call light. You would raise the appropriate number of side rails and lower the beds to the lowest position. You would dispose of any used supplies, remove your gloves, perform hand hygiene, and then document and report the patient's response and the expected or unexpected outcomes of the IV insertion.